Okay, well, welcome everybody. It's nice to have everybody here. We want to give a special thanks to the the Health Department here in Falmouth for inviting us to speak tonight. Welcome to our program this evening is going to be called Vaccine Confidence, and we're looking forward to sharing information with you tonight, and it'll be an opportunity to ask some questions. My name is Lisa Bushy. I'm a registered nurse, and I work for the VNA of Cape Cod. I have been managing the immunization program for Cape Cod for over 10 years, for children and for adults. I also provide a nutrition education program that I go into the schools here on the Cape and teach 3rd and 4th graders how to read food labels and to make healthy food choices. Currently presenting programs here in the town of Falmouth, so it's been really fun to work with the kids, and they really embrace. We do a pre-test and a post-test, and they really embrace the knowledge of healthy eating. So I have through the support of the Department of Public Health's Vaccine for Children program, I have worked closely with them through the years and helped to provide children here on the Cape many vaccines. We've done hundreds of vaccines through the VNA throughout the years. As we know, vaccines can be costly. In the past, the program has primarily served children that have no resources available to them or to gain access to vaccines. Meaning that they have no primary care, no insurance, or maybe minimal insurance. But I see many children that have come from other countries with very complicated immunization records. And we work hard to translate them and to really get them caught up so that they can integrate into the school system. The Massachusetts meet the Massachusetts school requirements, excuse me. But for the most part, the state vaccines are available to all children. The VNA currently has two clinics per month, one in our South Dennis office and the other one in Falmouth. These clinics are by appointment only. Most often the children are referred to us from the school nurses. I've worked with them for years to establish vaccine competency in the school systems. The VNA also utilizes a system called the MIIS. It's the Massachusetts Immunization Information System. It is a secure and confidential web-based system capable of electronic data entry and data exchange. And the benefit of this tracks, basically what it does is track children's immunizations. And it requires a mandatory reporting for all immunizations administered in Massachusetts. It allows access to physicians, to Board of Health, to the VNA, and to schools in order to check the children's immunizations and make sure that everything is in place. The benefits of it are that it prevents over-immunization and under-immunization. It helps identify due or overdue immunizations. It provides a vaccine usage report. And it assists schools with student immunization coverage. So it's really easy to be able to track the children who are not being immunized. It's really a very good system. For me, when students come to me, or any child comes to me really, with a parent consent, I generally put them, unless the parent is not accepting of it, which I haven't had yet, I usually put all children in this system. So when they come to me or when they return, I have them in my system. The state can track them, and then also it's available to primary care when they connect to primary care. So, with the concern that some of our community immunization rates have been lower than normal over the years, I've asked Rebecca Vanucci from the Department of Public Health in Boston to discuss the topic of vaccine confidence. So through tonight's program, we hope to expand immunization knowledge and to answer questions and concerns that you may have regarding immunizations. A little bit about Rebecca. She is an immunization outreach coordinator for the Department of Public Health and a co-facilitator of the Massachusetts Adult Immunization Coalition. Her roles, Rebecca plans strategic educational outreach to providers, to patients, the community, and teaches them all about immunizations. Rebecca coordinates the major pediatric and adult immunization conferences that I attend every year, and as well as regional immunization updates. She's a member of many coalitions and working groups that focus on increasing immunization rates. So she has received her master's degree in history of environment, technology, health, and medicine from Rutgers University. I'm happy to have her here tonight, and I know she has a lot to share with you. Thank you.
All right, so thank you, Lisa, for that wonderful introduction, and thank you to the Falmouth Health Department and Mallory for having this program. So today I'm going to be discussing vaccine confidence. Before I get started, I wanted to just show this quick little movie about a cute baby.
For parents, there's no greater joy than watching your child grow up happy and healthy.
And so long before Parker ever walked on his own, we were taking steps to help make sure he'd be healthy for life. We knew there'd be boo-boos, bumps, and bad dreams.
We also knew a little love could go a long way, and that we would need a lot of help along the way.
Some of that help came from Parker's doctor. As first-time parents, we worked together with Parker's doctor to do everything possible to keep him healthy. We had so many questions about his development and care.
And protecting Parker from serious diseases was our priority. According to our doctor, that included getting him vaccinated and sticking to the schedule that the CDC sets. Our doctor told us that the American Academy of Pediatrics and the American Academy of Family Physicians also approved the recommended immunization schedule.
Seeing that so many medical professionals were on board made us feel more comfortable following the schedule to protect him from everything from hepatitis B to polio.
And knowing he was protected gave us something to smile about.
Especially since when we took him back for his shots at 4 months, the nurse helped us understand that we were giving Parker the best protection there is from 14 serious diseases before he turns 2 years old. I'll admit we were feeling a little anxious about his shots, but the nurse also explained that we could comfort him by holding him during his shots and swaddling or feeding him right after. So we felt better knowing we could help him feel better.
Thankfully, each time we took him to the doctor, it got a little easier on all of us, and just understanding we were protecting him made us feel better.
Even more so after we heard that kids in the US still get some of these diseases, like whooping cough and measles.
That sounded a little scary, but our doctor reassured us that the immunization schedule is designed the way it is to provide babies protection early in life, before they are likely exposed to life-threatening illnesses. So by keeping Parker on schedule, we were giving him the best possible protection. We also learned that to give Parker that protection, we needed to make sure he got every recommended dose of each vaccine.
And after all the research we did, we learned about some of the diseases that vaccines prevent that we hadn't heard of before we had Parker. Like, we didn't know that Hib and pneumococcal disease could cause pneumonia and meningitis.
Even though he's bigger and stronger now that he's a year old, it's still important to stay on CDC's vaccination schedule. He'll need a few more shots before he enters kindergarten, but in the meantime, he'll be protected against serious diseases like measles, mumps, rubella, and chickenpox.
And each time we take Parker to the doctor, we know we're doing the best thing for our child by giving him a healthy start.
More than that, we're not just protecting Parker, we're protecting his friends at school, his cousins who come over on the weekend, and really everyone in our town.
He's getting more and more independent, and honestly, it's a little scary to watch him climb the stairs on his own. At least we've done everything in our power to keep him safe and healthy.
And the older he gets, the easier it is to see just how healthy he is. And thanks to vaccines, it's easier for us to not have to worry quite so much about whooping cough, the flu, or any other vaccine-preventable diseases.
Now that we've been through the schedule once, and we understand how important vaccines are for protecting babies, we'll do our part to keep our new baby up to date on her vaccines too.
And even though there aren't vaccines to protect her from broken hearts or falling off the monkey bars, maybe we can count on Parker to help out with those. At least we can rest assured that she and Parker will be protected against 14 serious childhood illnesses. And that's something to celebrate.
Help to make sure your child's baby book is filled with happy, healthy memories. Immunization, powered to protect. For more information about vaccination, visit cdc.gov/vaccines or call 1-800-CDC-INFO.
Great. So I just wanted to start with that video to really personalize this topic, because we often hear about vaccines, but to see it in that kind of way through Parker and his story, it's a really powerful way to think of it. Nope. There we go. Nope. All right. So I'm going to be talking today about vaccine confidence. So first of all, many of you have probably heard of vaccine hesitancy before, but I'm trying to change this terminology into vaccine confidence. And that really means we want to choose it for 3 different reasons. The goal is to instill, build, and maintain vaccine confidence. So you want to be totally confident in the entire system. And confidence encompasses hesitancy. That means if someone is fully confident in the vaccine system, they will have less hesitancy about receiving the vaccine or having their child receive the vaccine, and vice versa. So if they are lacking vaccine confidence, they will be more hesitant to receive recommended vaccines. And also, questions and involvement of parents should be respected. We don't want to label anyone vaccine hesitant. Instead, we want everyone to know that you can have questions about vaccines, and you should talk to your medical provider about it and get good sources of information. So confidence is really the amount and level of trust in the recommended immunizations, in the provider who administers them, and in the process that leads to vaccine licensure and the recommended immunization schedule. So again, if you're more confident, you are less hesitant. So vaccine confidence used to look a lot like this. And so people might recognize some of the images on the screen. So in the middle, we have Jenny McCarthy, who has discussed her belief about autism and MMR and how vaccines can cause autism. In the middle, we see on the right-hand side, this is Andrew Wakefield, whose 1998 study about MMR and autism led to this whole idea about autism being linked to vaccines. I'll talk about him more in a little bit. And then the vaccine book, which we see on the left lower hand side, is the Dr. Sears book. This is when people say they want to use an alternative schedule. This is where it comes from, the Dr. Sears alternative schedules in this book. So it used to look a lot like this. But recently we've seen some shifting in vaccine confidence. So first, when parents opt out of vaccines, all kids are in danger. This is written by the woman who's in the wheelchair. She actually got polio when she was a child in India, and and the whole article talks about how we really need to protect all of our kids because she knows the real consequences of it. Vaccinations rise when parents chat with other parents. This article is actually from a wonderful project in Washington State called a community immunity. It's training parents to be advocates for vaccines, to talk to other parents about it, because we know, daycare talk and playgroups talk. That's where you go to a lot of friends for your information. And then another measles outbreak that didn't have to happen. You probably have heard of a recent measles outbreak in Minnesota in the Somali American group. And so that is showing that because of the people who are lacking vaccine confidence, this outbreak did not have to happen. And actually, Andrew Wakefield visited this community multiple times to talk about the link between vaccines and autism, which I will go over more. And then, of course, Disneyland. And this editorial says, blame Disneyland measles outbreak on anti-science stubbornness. So I got the privilege of starting with the Department of Public Health right during the measles outbreak, and that's a wonderful time to become the outreach coordinator for immunizations. But it really made people realize that measles is still there and still present. So what's happening? Disease outbreaks. We're seeing measles, we're seeing mumps, we're seeing meningococcal disease outbreaks, and pertussis especially. More different vaccine voices. So I know many people have heard of vaccines on your Facebook feeds and things like that, but more people are becoming vocal advocates of it. And I will go over a couple examples of parent advocacy groups that are in favor of vaccines. And people also on Facebook and social media platforms that are saying that I support vaccines, you should get your children vaccinated too. And then the Andrew Wakefield 1998 study was discredited. So this was fully retracted, only looked at kids displaying the signs of autism. It actually only looked at 12 kids. I'll go over this a little more in detail. And more than 20 studies have been done that looked at this connection and showed no link between MMR and autism. And the Institute of Medicine actually then looked at all of these studies and went one step further and said, not only is there no link between MMR and autism, but we should stop concentrating on this believed link and look at other ideas of what causes autism. So that's a really powerful thing that they did. So this is a recent Medscape article on vaccine acceptance. So this is a survey of providers. So providers were asked, compared to a year ago, how has the willingness of families to accept vaccines for their children changed based on whatever you think? So children's vaccines in general, children's measles vaccines, and the recommended vaccine schedule. So you can see in the dark blue that there's been more acceptance for all of the vaccines. So they're seeing a more positive belief in the vaccine system. So if we are seeing more acceptance, why are we seeing more acceptance? And what do you attribute to this change? So more of them say it's more general concern about infectious disease. And then they're also more fearful of their child contracting a vaccine preventable disease. So maybe they're seeing the Disneyland, they're seeing other outbreaks nearby. An interesting one is the denied admission to school, daycare, and camp. So it's 44% in this 2016 survey, but the year before was 33%, so that we see how that's increased. So people are saying, I'm getting denied entry into school, so I'm going to make sure my kids are vaccinated. But another really important one is pressure by other parents. So this idea of social norms, and the majority of people do vaccinate on the recommended schedule, and they're making sure that their friends are doing the same. So they might be more vocal about advocating for vaccines. And this is just a reminder that very few US toddlers have received no vaccines at all. So Healthy People 2020 is a kind of a metric by the CDC and to say this is what we want for all different health values. And for immunizations, they want to say that less than 1% of kids have no vaccines at all. And so you can see since 2008, we've been under it. We've met the Healthy People 2020. This is showing that the majority of people are vaccinating. It is the social norm. And so we should be proud that we have high immunization rates. But we should still pay attention that when we are aware of areas that don't have high immunization rates. So in Massachusetts, we have really fascinating data that shows how we're doing. So overall, Massachusetts, this is kind of a busy slide. This is the estimated vaccination coverage among kind of toddlers, the 19 to 36-month-olds from the National Immunization Survey. So this is a national survey that's representative for the states and the national level. And so you can see these are the recommended vaccines on the left-hand side. I'm not going to go into each one in detail, but Massachusetts, in the blue, you can see is doing better than the national average in all of these vaccines. And for the ones that they are not doing better, quote unquote better, they're the same as the national average. So Massachusetts can be really proud that we have really good immunization rates. But that does not always reflect county level data or even school data. Local level is not captured in the National Immunization Survey. So we want to be able to know where that might be. So this is an interesting graph that shows our religious and medical exemptions in Massachusetts kindergarten students. So as a reminder, in Massachusetts, we do not have a philosophical exemption. We only have a medical exemption that needs to be renewed every year. So this is if a child has some condition and cannot get a vaccine for a medical reason, contraindication, that means they can't get it, or religious beliefs. It's against someone's sincere religious beliefs. And so those are the two exemptions we have in Massachusetts. And so this shows our exemption rates over time. So you can see, especially around the 2000 year mark, we see them increasing more. Both the total exemptions, but especially the religious exemptions. But in the past few years, we have seen a small kind of tapering off of our exemption rates. And so we are really lucky that in Massachusetts, you know, the national average is about it's 1.9% exemption rates. Other states can have them up to 6-8% exemption rates. So in Massachusetts overall, we're at 1.3. So that's good. But some areas of Massachusetts have higher rates of exemption than even the state average. So you can see these are by county, and you might see in Middlesex, Essex, Norfolk, they're all a little bit lower than the state average, but you can see where some of the higher counties are. Another way to kind of see this information is on a map. So again, the state average is 1.3%, and so you can see on the Cape and the islands, as well as Western Massachusetts, there are higher rates of exemptions. So these are among kindergarten students for total exemptions, but this is pretty much reflected in our 7th grade data as well, but I'm just using kindergarten as an example. So this is kids with an exemption, but a kid could have an exemption to just one vaccine. They might have an exemption to only MMR or only hepatitis B. So we wanted to start really calculating how many kids have no vaccine. And so about 2 years ago, we started calculating that. So this is the rate of kindergarten students with an exemption with no vaccines. So you can still see this kind of regional trend of the Cape and Islands and Western Mass of the number of kids, the percent of kids that have no vaccines at all. And so I'll be talking about herd immunity and what that means, but we need to pay attention to this because it could affect herd immunity. This is a new metric we started looking at because we want to know, we have our immunization level data. So we know what percent have DTaP or MMR, and we know the percent that have an exemption. But in the middle is called the immunization gap. So immunization gap are the kids that we might not have a record for. Maybe they just moved in to a new school or moved from a new country, or maybe they're on a catch-up schedule. So they're not meeting school requirements at this time, but maybe the school is allowing them in the school because they're, on faith that they're on a catch-up schedule. So we want to pay attention to this immunization gap because it might be some low-hanging fruit here. So some of these kids might have records, and we just want to make sure that they're, brought to the school nurse. They know that they're fully vaccinated. And so some areas where you're seeing the darker blue, which is like the 18.7% in Boston, some of this is administrative. So, the exact record for that child is not at the exact school that they are attending. So we just don't know what percent of this immunization gap are kids who don't have a record at all or those who are on a catch-up schedule. We have no way of figuring that out. So our school immunization data and exemption data are posted and are public. So if you are interested in knowing what your school's immunization rates and exemption rates are, I really encourage you to look at our website, which is mass.gov/DPH/IMM, and go to school immunizations. And you can see the rates through the years. You can see county level data, and you can get all of this information. If you want to know what is my elementary school's data, you can look it up. Except for 2 caveats. Schools with less than 30 children don't have their rates posted. We collect it, but we don't post it because of privacy laws. And then schools that don't respond, even after our best efforts to get that information, are indicated on the survey. So you'll be able to see. So this is what the page looks like. So if you are interested, you can see the website, and this is where you get the data. We have it for childcare, kindergarten, and 7th grade. And then you would get the kind of Excel spreadsheet or Word document or PDF, depending on what you're looking at, to see the information about it and how the data is collected. And then this is what it looks like. So you can see the name, the school name, if it's private or public, where it is, the county, and then the individual vaccines that are required for school, as well as the unimmunized and the no record and an exemption. Do you have a question?
Yeah, do you know if charter schools have the same requirements for vaccinations as public?
Yep.
I guess they are public schools in a
Yep.
way. Yeah, okay.
Yep.
And private schools.
And private schools too. That's why we say private and public. So how can we use this really valuable data to address vaccine confidence overall? So first you look up your school immunization rates, see what they are. And if your immunization rates are high, you can be like, we are fortunate to live in an area of high immunization rates. However, there can still be pockets of or under immunized children. We need to keep our rates high to protect kids. And so be an advocate. You can be an advocate saying, aren't we lucky we live in this area, but let's just make sure everyone is continuing to vaccinate because it takes everyone, takes a village. If immunization rates are low, our area might be susceptible to vaccine preventable diseases and outbreaks. It's important to vaccinate your child on the recommended immunization schedule. Please tell your friends because of this herd immunity that I'm going to be discussing, and then be an advocate because again, we want to make sure everyone is saying vaccines are good and safe and everyone should be vaccinated. But I understand that immunization is kind of a complex communication world. So you hear about it in all different places. You hear about it in the news, you hear about it on your Facebook, you hear it from your sister, you hear about it at Thanksgiving. So what do you make of it? So because vaccines work and are effective, we don't always see vaccine preventable diseases in our face. We don't have to have that fear of putting our child in a swimming pool in the summer for fear of contracting polio. So we're really lucky to have that. But because of that low disease awareness, we are increasingly focused on the risk of vaccine. So our risk analysis is off. And we have a low tolerance for those vaccine risks. So we're not saying that there's no risk at all in vaccines. You might get a sore arm. There might be a fever. A kid might be cranky. But we need to put it into mind that you're protecting your child against serious diseases. And it's complicated, right? There's a lot of vaccines. Many people ask, well, why are there so many vaccines? I didn't get these many vaccines when I was a kid. So I'm going to go over about how many vaccines we get compared to what in even 1980 there was. But I get it. It's complicated. It's hard to keep track of. Time is often limited. So you get to see your pediatrician for like 15 minutes if you're lucky. You have a lot of questions. So I know when I have 2 young children. I have a 6-year-old son and a 4-year-old daughter, and I remember when they were babies especially, I made my list. I was diligent, making my list about what I need to ask my pediatrician when I'm in there. Top of my list every single time, why are they not sleeping? And I realized there was a light at the end of the tunnel. They did end up sleeping finally. But you know, it's limited, so you don't have as much time to talk to your pediatrician about everything you want to ask. And then there's many places to find and get information. This is where Dr. Google doesn't cut it for your kids, right? So we can't just trust what we find on the internet. But there are good sources of information on the internet too, so being able to figure out what they are. So research really shows that parents are generally confident in the safety of vaccines, the effectiveness of vaccines, the benefits of vaccines, and the number of vaccines a child gets in their first 2 years of life. This is what our qualitative and quantitative data show. So that's good. We're confident. But they still might be anxious about the shot visit. So no one wants to see their baby cry. No one wants to have this idea that their kid's going to cry or have any kind of sore arm. You know, as a parent, you want to protect your kid, and so you're saying, I don't want them to cry. So they're a little anxious about the shot visit. About 25% of parents report having at least a little anxiety, and they still might have questions, and this is kind of a cycle. So they might have questions, which then makes them a little anxious, and it just goes around and around. But we have to remember that questions do not always mean concerns. So you can have questions. Ask your pediatrician, ask your healthcare provider, what should I expect with this? What is it protecting against? Why do I need to do this? And so Voices for Vaccine is a parent advocacy group that is amazing. They are for parents, by parents, really giving evidence-based data and information to parents in an easy to understand way. They came up with this wonderful toolkit to say, how do you talk to people who might be vaccine hesitant? They didn't get my memo about vaccine confidence, apparently, but so they want to talk to people about how do you address vaccine confidence. And they recognize that there are some common patterns in parents that might be lacking vaccine confidence. So one of them is feeling a lack of control or needing to be in control of health outcomes. So this is a parent that might have had a major illness. They might have had survived a natural disaster. They might have moved to a new country. They need to be in control of their environment, and they just they don't want anything else going on. Another thing is a negative healthcare experience in the past. So a good example of this is a new mom, her first baby. Maybe she had a pregnancy or a birth that did not go the way that she thought it was going to go. And then she walks into the pediatrician's office and says, I can control something. I can control how many shots you're giving my baby. And so I'm going to delay it. I'm going to say, I don't need any of those right now because I just had a traumatic thing happen to me. I want to control what I can. So that's an example of a negative health care experience in the past. Buying into particular parenting style. So we all know that there are certain parenting groups or philosophies that really go into this whole, we want to be more natural, homeopathic, vaccines aren't natural, and diseases are more natural, and so maybe that's part of the parenting style. A distrust of government or corporations. So if someone is saying, vaccine manufacturers are making a ton of money on us, or we don't know who's making these recommendations, the CDC is bad, we don't know what's going on, that might be what they are believing. And so we need to be able to address that and get to the root of that. And then again, I've kind of brought this up before, but a flawed risk assessment involving vaccines and diseases. So because they're not always seeing the diseases, they might not realize how serious they are. So whooping cough, especially in infants, can be very serious and can actually kill babies. So we want to realize this when we're protecting all of our children and ourselves. And then chemophobia. So that's a fancy way of saying that they're afraid of what's in the vaccine. So they're saying, I don't know what's in the vaccine, like aluminum, or I heard mercury, or whatever it is in the vaccine, and so they don't know what it means. So we need to make sure that all parents understand the kind of science behind it. And I'm going to go over that a little bit. So let's remember the benefits of vaccines. So vaccines are one of the greatest public health interventions of the 20th century, second to only clean water. It saved many, many, many lives, many hospitalizations, just sicknesses, morbidity, and mortality. So the Vaccines for Children program, which Lisa mentioned, was established in 1994 to make really vaccines available to uninsured children. But in Massachusetts, we are really lucky. We are a universal state, which means that all the routinely recommended vaccines are offered by the state. And so wherever you go, you can get state-supplied vaccine for anyone who is enrolled in the immunization program. So it's a really great thing that we have in Massachusetts. But CDC estimates that of the children born between 1994 and 2013, vaccination will prevent 322 million illnesses, which is more than the current population of the entire United States. Help avoid over 700,000 deaths, which is greater than the population of Boston. I like that. The CDC infographic included Boston. And then saved nearly $1.4 trillion in societal costs. So this is a huge savings in human life and also societal costs. So I'm going to go over a couple individual diseases just to remind us about what we're protecting against. So measles, as I like to say, isn't just a little rash, right? It's a serious vaccine-preventable disease. It can be dangerous, especially for babies and young children. So classic symptoms, high fever, cough, runny nose, red watery eyes, then the characteristic rash. It can be very serious. This is our kind of test for herd immunity, which is the level that you need to maintain a protective barrier for everyone. And measles is one of the most contagious diseases. So if we all came into this room and someone had measles and we were not protected against it, measles could live in the room for up to 2 hours after we leave, and 9 out of 10 of us would get measles if we were not protected by it through either getting measles or vaccination. So it's a really contagious disease. So you have the power to protect your child because 1 out of 4 people who get measles will be hospitalized, and 1 or 2 out of every 1,000 can die even with the best care. So don't play Russian roulette with your child. And this is a kind of characteristic measles rash. Another one is why you should never RSVP yes to a chickenpox party. So if you've never heard about what a chickenpox party is, this is the idea that someone has chickenpox, you go to that house to get exposed to chickenpox, and you will get chickenpox. And before there was a vaccine, there was some validity in this, right? So when I was a kid, I'm an only child, so I didn't get exposed from older siblings or anything like that. So when my mom heard that someone in our town had it, I went over, I got it, went home, and then had chickenpox. But one of my friends who also went to that same house, she got chickenpox just like I did, but then had complications from it. And she got infected blisters all over her body and has scars to this day. So this is why we have a vaccine to protect against it. Another story about going to a chickenpox party is there's a pediatrician in Philadelphia that had a patient that came in, a mom that didn't want to vaccinate for chickenpox. And so she got sent her kid to a chickenpox party just a few years ago after a vaccine was available, her 8-year-old, and got chickenpox like they would. It's highly contagious. And then the daughter got pneumonia. She ended up in the hospital, and she ended up dying from chickenpox. So this is, again, not a little rash. We should not be playing Russian roulette when we have a vaccine that can protect against it. And so this is a kid that has chickenpox, and this is just a reminder that before the varicella vaccine was available, 4 million cases of chickenpox a year, leading to about 11,000 hospitalizations and about 100 deaths every year. So again, it's not worth it to risk it. Whooping cough is another big one that people talk about, which is also known as pertussis. And the scary thing is it can start like a common cold and you might not even know you have it. So runny nose, low-grade fever, coughing. And so especially adults don't know they have it. We did have a peak in the United States in 2012 with over 48,000 cases of whooping cough reported, but this is just the ones that were reported. So some might not even been reported. And 15 infants younger than 3 months old died. So these are the kids that can't be protected, yet they haven't had their own dose of DTaP. Luckily, we have an updated recommendation that says with every pregnancy, a woman should be getting Tdap during every pregnancy, even if they're like back-to-back pregnancies, you have Irish twins or whatever it is. You get Tdap to make sure you're getting the antibodies to pass to your baby, and that offers the best protection right at the beginning until they can get their DTaP at 2 months. So I just want to give a story. This is used with permission from the family about baby Brady. So baby Brady was our last infant pertussis death in Massachusetts. He was born in December, or November, right around the holidays. He was the 3rd child with 2 older sisters who loved him and doted on him, and he was the little boy in the family. And, I experienced this, especially when I had a second. With my first, I kind of stayed home and like everyone washed their hands and hand sanitizer. The second one, you go out a little bit more. I don't have a third, but I expect you go out even more. And so they're going to holiday parties and going to dance recitals in the mall, shopping, everything. We know that that's where they went. And around Christmas, he started getting a cough. a little cough when he was about a month old, and coughing, and it lasted. They took him to the pediatrician, and I think it's just a cold. It's a winter cold. It's a winter cold. It got worse, and it got worse. Went back to the pediatrician, and still, it's just a little cough. And so finally, once they realized that he had to be ambulance showed up at their house when he almost stopped breathing, went to the hospital. They still really didn't know what it was, and then they airlifted him into Boston, where they finally discovered it was pertussis, and he unfortunately died about 2 days after he ended up in Boston. And so we still don't know where he got it. None of his immediate family tested positive for pertussis, but you never know where you can get it. So this is really just showing that everyone should be protected to the best of our ability. So Every Child by 2 is an organization to really address that. Every child should have all the recommended vaccines by the age of 2. And they started a new campaign called Vaccinate Your Family to really reiterate that everyone needs vaccines across their lifespan. And one of their big initiatives is making sure people realize that getting the whooping cough vaccine or the pertussis vaccine really helps everyone. Because kids need to have 5 whooping cough vaccinations with their first dose at 2 months, and then goes through 4 to 6. And about half of the kids who are under 12 months who get pertussis are hospitalized, and about 1 out of every 100 infants will die from pertussis. So this, these are really scary statistics. And 85% of cases get it from an immediate family member when the source is known. So we as family members and who care about our family members have the power to protect them too, through everyone getting the recommended Tdap if you have not already, and then again with the pregnancy, with every pregnancy for a pregnant mom. So I'm just going to show this quick video when it loads. Whoops. There we go.
Thank you. Oh, that feels so good.
Laura Stevens will soon be a first-time parent, so she watches her friend and mother of 4 to see how it's done.
Please don't grab the cup from him anymore, though. That sounds like gibberish to me.
Laura also relies on her friend for advice.
Supposed to be getting the vaccine for the whooping cough? Yeah, the whooping cough vaccine. I just got mine on, my appointment was last Wednesday. So have you done it with all your kids?
Health experts recommend pregnant women get a whooping cough vaccine, also called Tdap, during each pregnancy to give babies important protection in the first few months of life before they're old enough to get their own vaccines.
Perfect. Babies moving around okay?
Why is early protection important? Most babies who get whooping cough during those early months struggle to breathe and get very sick. For some, it can be fatal.
So how does my getting the whooping cough vaccine protect my baby?
What happens is when you get the vaccine now in the 3rd trimester, your body forms a protection. And in the 3rd trimester, that whooping cough vaccine actually delivers that protection to the baby right from birth.
Is it safe then for me and the baby?
Absolutely. In research, there's been no evidence of preterm labor, no evidence of low birth weight. In my experience, I haven't seen any issues or problems with it.
Unfortunately, whooping cough cases are on the rise. We now see between 10,000 and 50,000 cases each year in the United States, and whooping cough is highly contagious.
Because the disease is often mild for adults and older siblings, caregivers may not know they are infected and mistake it for a cold or other minor illness and pass it along to the baby.
It's recommended that women get vaccinated during the 3rd trimester of each pregnancy, and this is because the vaccine's protection decreases over time.
So let me show you the nursery. We've just really started getting it together. I just really want her to get here and just to be able to hold her and experience all these things that my friends have been able to experience.
You, like Laura, have the power to make sure your baby is born with protection against whooping cough. Ask your doctor or midwife about getting the vaccine to help keep your newborn safe from the moment she takes her first breath.
All right. So again, this shows the benefit of getting Tdap with every pregnancy. So as a reminder, vaccines really protect public health. So we all have a public health commitment to protect each other and each other's children by vaccinating our own family members. So this image on the screen is what I'm referring to as herd immunity. So the blue on the top are those who are not immunized but still healthy. So this is really when there's a population that's not vaccinated. And so the red are the people who have a vaccine preventable disease. And when no one is immunized, contagious disease spreads throughout basically the entire population. So you can see everyone turns red. And in the blue, in the second one, these are still the ones who are not immunized but still healthy. And then the yellow are immunized and healthy. And then you still have those two cases. So some of the population getting immunized is not going to stop the spread. You need to maintain a protective level for the entire population. So you need to have the majority of people in yellow. So you can still see there were 2 cases on the left, and on the right there are 3 cases, but that's much better than an entire population getting a vaccine preventable disease. And herd immunity really varies by disease. So as I mentioned, measles is kind of our indicator of when herd immunity might be waning, but whooping cough needs a protection of like 92 to 94%, varicella 90%, and mumps 75 to 86. So we need to have these levels for herd immunity to protect everyone.
I have a question about that.
Mm-hmm.
Are those levels for certain sizes of population, or even just small, like if it was like,
A school.
Yes.
Right.
Yeah.
So this is for this is the percent of population that needs to be vaccinated or protected. So either by having the disease or through vaccination. Any group, any size group. So this is a good example of why we want to protect for the whole group. So this is a self-portrait of Riley. She's an 8-year-old who had a heart transplant. So because she has this kind of medical condition, she can't receive live vaccines like the measles, mumps, rubella, and chickenpox. So she really relies on everyone to protect her against those diseases. So if we have our herd immunity dropping, she's not going to be as protected against those vaccine preventable diseases. So this is a good reminder that there might be people you don't even know who can't receive vaccines, and we have to protect everyone. So vaccines are safe. Since vaccines are used in healthy people, they're held to the highest degree of safety. So unlike other drugs that we might be using for cancer or heart disease, we have a higher threshold of what is acceptable in vaccines, but you're more willing to take risks if you're trying to, help cancer. So again, these are used in healthy people, so they are held to the highest degree of safety. FDA licensure involves safety and efficacy studies, and I'm going to show you kind of how vaccines even come on to the market and are used. So the journey of your child's vaccine. So this is how, through the different trials and clinical trials, how vaccines come on the market. And this is even done after extensive lab testing is even done to see if a product can even start being tested in humans. So this takes years and years to get vaccines onto FDA licensure. And so they're only licensed if they're safe and effective and the benefits outweigh the risks. And then after a vaccine comes on to the recommended schedule, FDA and CDC closely monitor to we have really robust post-surveillance systems in place to make sure that these vaccines are continuing to be safe and effective in all of our populations. So you can look at this infographic in more detail on the CDC's website. It's called The Journey of Your Child's Vaccine. But as I mentioned, parents, people might be more anxious about the actual shot visit. So how can we make the shot visit less stressful? So there are kind of like 9 things you can do to make a shot visit less stressful. First of all, you read up. So before you go into your visit, what are they getting today? Trying to know, are they getting MMR? Are they getting GTAP? Are they getting varicella? What vaccines are they getting? And having your questions for your medical provider. What is it protecting against? What are some of the symptoms that they might have? just know it before you go in. Bring your child's favorite things. You want to bring a favorite stuffed animal, a favorite book, whatever they like to have to comfort them. You could offer a sweet drink. That doesn't always mean juice or anything, but if you have a baby, you can nurse them right after. You can provide that kind of comfort too. Be honest. If you have older kids especially, say this might pinch a little bit, but aren't you glad that we're doing something and it keeps your body really strong? Use those kind of terms instead. And be calm and happy. So if you're saying, oh, that mean nurse is giving you a vaccine, your kid's gonna then start thinking, oh, that's a bad thing, and the nurse is bad, and instead say, oh, aren't you lucky that the nurse is gonna help you protect yourself from scary germs and bugs and diseases? We don't want to get sick, so let's do a power shot to help us stay healthy. So if you're happy and calm, then the child will stay calm. Another thing is distracting your child. So, yeah, it's going to pinch a little, remember? So just say, look at this fun book, look at the poster, let's sing your song, and try and really distract them. Swaddling your baby will be helpful. Of course, they'd have to have a leg out or an arm out depending on how big they are and what age they are. But especially afterwards, if they're comforted by swaddling, do that after. And big kids need support too. So even if kids get older, I remember when my son was 4 and needed a couple of vaccines, I had to bring his favorite superhero and make sure he's getting the comfort too and getting a big hug afterwards. And then care after the shots. So knowing what to expect after the shot is really helpful, so you know what's normal and that you can address it. So review the information that your doctor gives you, that they will give you in a vaccine information sheet, which outlines side effects that might be expected. And so some certain side effects that could happen: fever, fussiness, redness, or a lump at the site of injection. These can happen, and so they could happen. They might not, but they could. And then use a cool, wet cloth to reduce swelling, redness, soreness in the place where the shot was given. You can reduce any fever with a cool sponge bath. If your doctor says it's okay, you can give a non-aspirin pain reliever. Talk to your doctor first. Give your child lots of liquids. It's normal for some kids to eat less during the 24 hours after getting vaccines. And pay extra attention to your kid for a few days. If you see something that concerns you, call your doctor. That's what they're there for. If you have questions, go to them. So I want to go over a couple myths that you might be hearing about vaccines through wherever, Facebook, your sister-in-law, or however you're hearing about it. So first is that MMR causes autism, or vaccines in general cause autism. This is the biggie. This is usually the elephant in the room. So I talked about Andrew Wakefield a little bit. He came out with the 1998 study that looked at only 12 children, and they were already displaying the signs of autism. So that is not a very sound scientific method if you're looking at 12 kids who are already showing the signs of autism. And as I mentioned, many large, well-designed studies have shown no link between MMR and autism after. But autism usually becomes apparent around the same time as MMR. So MMR is given around a year old. And so that's often when you start seeing some signs of autism. Just because they're happening at the same time doesn't mean that it's being caused by it. But parents might be saying, oh, I remember they got the vaccine and then they became autistic. Well, you might be realizing some of the signs of autism around the same time that they're getting their MMR vaccine. But again, it doesn't mean that it's causing it. And autism probably has some multiple components, including genetics. So one study found that if one identical twin had autism, the chance that the second twin had autism was greater than 90%. But with fraternal twins, the chance was less than 10%. So this is showing a genetic link. So identical twins have higher risk. And also, there have been some theories about advanced parental age. So if either parent is older, they have a higher chance maybe of autism. So there are other theories that might go into why autism is increasing. And I get it. Parents are saying, we're seeing autism rise. What's going on? They want a reason for it. So another reason might be because we have more sensitive diagnostics. We have more sensitive testing for autism that we didn't have 30 years ago. So we might be capturing kids that we might not have captured 30 or 20 or 10 years ago even. And so we're seeing that rise. But then also, again, there might be other connections that many experts are saying, let's look into these other ideas about what's causing autism, because we want to know what's going on and provide some support to families. And so as I mentioned, the 1998 study was based on 12 pre-selected children. In 2004, 10 of the 13 authors of this study retracted their interpretation of it. The Lancet, where it was published, which is a really credible medical journal, fully retracted the paper. This rarely happens in medical literature, to be fully retracted from a medical journal. And not only just that, he was removed from the United Kingdom's medical register, and he is no longer allowed to practice medicine. So he was in the United Kingdom when he did this study. Now he lives in Texas. So we have him in the United States now, and he travels across the United States discussing his ideas of vaccines. But again, this study fully retracted, lost his medical license. I think that speaks for itself. And then also, there was also, showed that a series of articles showing that his work was not just bad science, but deliberate fraud. So he was deliberately trying to put this link and it's causing harm. It really did affect immunization rates in the United Kingdom and the United States, and more than that too. Another one is giving an infant multiple vaccines can overwhelm the immune system. So you're giving too many shots to babies, right? They're delicate, they can only handle a certain amount of things. So babies begin to be exposed to kind of immunological challenges immediately from the time of birth. So they're kind of protected in the womb, they're not exposed to everything. As soon as they come out into the world, they are bombarded, right, by immunological challenges. And they manage to have a good, robust immune system to everything that they're facing. And really, vaccines only use a tiny proportion of a baby's immune system to ability to respond. And so that comes back to this idea that I didn't get this many vaccines when I was a kid. Why do my kids have to get so many? So advances in science have really led to pure vaccines. So even though, in 1900, we only had one vaccine, which protected against smallpox, the number of antigens are the ingredient in a vaccine that invokes an immune response. There were 200 antigens in the one vaccine that protected against smallpox. And smallpox, as a reminder, is the only vaccine-preventable disease that we totally eradicated through the use of vaccines. And then in 1980, when many people have been vaccinated, the number of vaccine-preventable diseases was 8, so we're protected against 8 vaccine-preventable diseases, and had over 3,000 antigens in it. Today's vaccines, which protect against 14 serious vaccine-preventable diseases, has about 150 to 153 antigens. So again, science has led to purer vaccines. Aren't we lucky that we can protect against more vaccine-preventable diseases with these purer vaccines? So it's better to space out vaccines using an alternative schedule. So this is the Dr. Series alternative schedule. And when we hear someone saying, I support vaccines, totally, I just want to delay them. So we need to remember why delaying it is not a good idea. Because delaying really just increases the time that your child will be susceptible to disease. The recommended schedule was made to protect children when they are most vulnerable to those serious vaccine-preventable diseases. So if you are spacing them out, if you are prolonging the time that they would get a vaccine, you're just making it more increasing the time that they are susceptible to that vaccine-preventable disease, which is when they need the most protection. So as a reminder, that Disneyland case, 667 cases of measles were reported in 2014. Majority of people who got measles were unvaccinated. 2014, over 32,000 cases of pertussis. Many more cases were undiagnosed. And really, if you're spacing out vaccines, if you're doing a delayed schedule, that means you're a busy parent, you're a busy mom, busy dad, you're gonna take your kid in way more to the pediatrician. office and sit there and wait and then go in during a really busy time that you could be, doing other things with your baby. And it's more likely to induce stress and needle phobia. So there have been studies that show like if you get one vaccine or one shot versus like 3 shots, the cortisol level, which is the stress hormone that we hear about, increases the same. So it's not gonna increase it just because of how many they get at one time, but if you're giving them on different occasions, they're getting more cortisol because they're having more stress by getting more shots, if that makes sense. This idea that natural infection is better than immunization. So this is, chickenpox parties and other things. Natural infection usually does cause a better immunity than vaccination in most cases. However, the price paid for natural disease can include paralysis, permanent brain damage, liver failure, liver cancer, deafness, blindness, loss of limbs, and death. It's not worth it. So again, it's not worth playing Russian roulette with your kid. One exception I just want to mention about natural infection is better than immunization is the HPV vaccine. Whoops. There we go. So the HPV vaccine actually invokes a better immune response than natural infection. So this vaccine is amazing. It has the ability to really invoke such a robust immune system, and especially younger kids, the 9 to 14, that they only need 2 doses. It's protecting against 6 types of HPV-related cancers. This is an amazing vaccine, and aren't we glad that there's a vaccine to protect against cancer?
Just going back to the alternative schedule, I had heard that if you use an alternative schedule, the amount of antigens over the whole series is much higher than the regular schedule. I don't know if that's true, like the total antigens received from the alternative schedule.
I don't know if that would be exactly correct because they're still getting the same vaccines, but just at a different schedule. And they wouldn't, it's not like you have the ability to separate out vaccines. So that's interesting. I haven't heard anything like that. I'll have to look into it. So this is taking us back to like, when should the bike come and go on? So should it go on before you get on the bike, while you're riding the bike, or after you get into a crash? So this is the same logic with vaccines. You want to protect your child and yourself before you are exposed to a vaccine-preventable disease. Here's another one. Thimerosal causes autism. So the form of mercury found in thimerosal, which is a preservative in vaccines, is ethyl mercury, not methyl mercury. So people get confused by this term of mercury. Ethyl mercury, think of it as alcohol. Okay, ethyl, think of it as alcohol. Methyl mercury, think of as like gasoline, okay? So methyl mercury is the form that has been shown to damage the nervous system. Although no evidence of harm has been demonstrated, thimerosal was taken out of vaccines as a precaution and because it can be. So because thimerosal was used in more multi-dose vials of vaccines, that's when you need a preservative in vaccines. It could be taken out of all the routinely recommended vaccines for children. So it hasn't been in vaccines for a good amount of time. And there we go, since 2001. And it is in a few influenza vaccine products, but again, not in all the routinely recommended ones for kids. And you have the ability to use a preservative-free flu vaccine. But again, it's kind of a double-edged sword because there was no evidence of harm, but it was removed. So then people are like, oh, it must have done harm because that's why you removed it. But even studies that didn't remove thimerosal, they didn't see any link or increase of autism. So ingredients in vaccines are harmful. Aluminum is a big one that people often talk about. So aluminum is used in vaccines as an adjuvant, which is an ingredient to improve your immune response. So it's making your body wake up a little bit more. Aluminum is the most common metal found in nature. So this is the 3rd most abundant element in the world. The greatest source is in food, actually. Infants get more aluminum through breast milk or formula than vaccines. So for example, by 6 months old, the aluminum in all the routine vaccines are 4.4 milligrams. Breast milk, on the other hand, are 7 milligrams. Infant formula is 38 milligrams, and soy formula is 117 milligrams. So we're not saying we're going to take away soy formula. We're not going to take away breast milk. And it's really important to remember that most aluminum taken into the body is quickly eliminated. So it's not like you're storing up aluminum in your body. And this is a continuation of with some other ingredients. So antibiotics are present in some vaccines as it prevents bacterial contamination. Additives like gelatin, like all of these, help vaccines stay safe when they're being stored. So they're needed to keep vaccines safe. And trying to make vaccines without these adjuvants, additives, and preservatives is really difficult. And these ingredients keep vaccines safe and effective. So another idea is that disease rates have dropped due to other factors than vaccination. So better living conditions have had an impact on disease rates. But really the big decrease in vaccine-preventable diseases has occurred after the introduction of a vaccine to prevent it. This is true with even newer vaccines like Hib and varicella, which is chickenpox, which has been introduced during the times of modern hygiene. And so when some big countries stopped using DTP, their pertussis rates jumped dramatically. So we can see, even with modern hygiene, if you're not using the vaccine, pertussis rates are going to climb. And several outbreaks, like the Minnesota one recently, is being linked to people who are not vaccinating their children, and especially in states that allow personal belief exemptions, which we are not one of those states that allow personal belief exemptions. Here's measles, for example. So you can see when the vaccine's licensed, we see a huge drop in measles cases. This is the incidence of Hib disease after a vaccine was introduced. So again, we're seeing these big drops because of vaccines. So this idea that vaccines are not effective, that they're really not working, so why do we need them? So most childhood vaccines are very effective. And especially when you're doing it on the recommended schedule. No vaccine is 100%. It says 100% there, but no vaccine is really 100% because, you know, people might not have the best immune response to it, doesn't offer the best protection, whatever it is. That's why we need to maintain herd immunity. But, you know, some vaccines recommended for adults are not as effective as childhood vaccines. That's mostly related to that adults don't have as good immune systems. This is why kids have a little bit more robust immune systems, but it's still showed to have an important protection. So adults should still get vaccinated because it's the best protection we have to protect them against vaccine-preventable diseases. So the facts. So vaccines give you the safe, proven power to protect yourself and your family from serious preventable diseases. I love this image. So if you're not vaccinated, you get no kisses. This is really to promote especially Tdap and pertussis vaccines. And following the recommended schedule offers the best protection. So these are some good resources that you can just have as reference. The Children's Hospital of Philadelphia Vaccine Education Center is a wonderful resource for anyone interested in some of these topics that we've talked about: autism, about too many vaccines, about different vaccine ingredients. So they have individualized fact sheets, like the facts of the childhood vaccines, like how do vaccines get recommended, how do they come on the schedule, and answering many questions. These are some parent-friendly resources you can go to: cdc.gov/vaccines/parents and /resources. You can find some great information to figure out what vaccines your kids need. These are some parent advocacy groups that I mentioned earlier, especially Voices for Vaccines. If you're really interested in becoming a parent advocate and learning all about vaccines to figure out how to talk to your friends, I really recommend going to their website. They give, they have tools to how to do a playgroup discussion about how to talk to your friends about vaccines and handouts. Really great resource. So the takeaway message is really the majority of people vaccinate on the recommended immunization schedule. Following that recommended schedule offers the best protection for you and your family. And really helping someone protect her children is the noblest form of friendship. Talk to your friends about vaccines. So with that, here's my contact information if people ever have questions. The immunization program's main number, if you ever have general questions too, we call it our 6800 number, which is 617-983-6800, and then my contact is there as well. And I think, again, thank you so much for having me. This is a wonderful program to remind everyone that vaccines are safe, effective, and offer the best protection.